In this presentation, I will indicate the development of a tool that measures parenting self-efficacy and encourage its use for the Mexican American minority to compare parenting programs. Similar to our nation's education platform adopted many years ago, the popular term "No Child Left Behind" was considered as a favorable method to improve the status of education by the United Kingdom in 1999. In addition to the community of educators, the consultation paper "Every Child Matters" included the involvement of health and social services. In a transformative call to action, the response included the implementation of the Sure Start Evaluation Support Program. The UK program supported this initiative because they believed it would be of great value and cost-effective. While research has given several findings of parenting programs, their methodologies have been weak. There have been few evaluations that have been supported by rigorous, robust outcome measures, but have been ignored and not considered for development as a standard or generic evaluation scale. Therefore, without alignment standards or rubric, there are difficulties in comparing parenting programs. Understanding the community of student learning is beneficial to understand the involvement of change. The participants of change will be all of the stakeholders. In this paper, we identify that stakeholders are the students, parents, teachers, and the government. Currently, the classroom is a diverse population with students who have attention deficit hyperactivity disorder, conduct disorder, and oppositional defiant disorder. They are prevalent in community samples all around the developed world and are common reasons for referral to youth mental health clinics. They are associated with significant impairment and maladjustment and have become a considerable source of public health concern. The cost of antisocial behavior are great, and it would be more beneficial to initiate treatment of disruptive behavioral problems early during the onset of primary school years. Other than pharmacological treatment, the treatments would be behavior therapy, parent training, and cognitive therapy. I consider that of these three choices, a parent training program would be the most important because it requires the involvement of a stakeholder. As mentioned earlier, the UK adopted implementation of the Sure Start parenting program. Unfortunately, while Sure Start removes the cost of service for the community, its significance and favorability declines to prospective consumers. Bunting in 2004 found that out of 60% of families interested in the parent training programs in the UK, really only 4 to 18% were estimated to have taken them up. The fault is assumed to be in understanding the views and perceptions of the target population. Furthermore, it is found that many parent training programs have poor completion rates. Despite reciprocity in the form of monetary compensation, still dropout rates are high at an estimated 40%. It is important to have well-developed theoretical constructs that measures parents' perceived ability to manage their children based on their own views and experiences of parenting, and which are applicable in a variety of settings. In the review of the literature, many evaluation studies were grouped based, but few drew on robust outcome measures and were limited to only one reporter. This is another clarification we need to consider. To begin, let's start at looking at Mexican American families. It is important to understand the cultural values and beliefs of Mexican American parenting practices, since they did make up 3/4 of the 15.2 million increase in population change. Comparing the 2000 and 2010 U.S. Census, we can find that more than half of the growth in the total population of the United States was due to the increase in the Hispanic population, with a change of 35.3 million to 50.5 million. Some cultural factors can enhance parenting behaviors and some can diminish parenting efforts, parent confidence, and can contribute to inconsistencies in parenting practice. Specific to this minority, those cultural factors include overcoming immigration, experiences of discrimination, segregation, racism, acculturation, and assimilation. Whilst minority families may have shared similar ecological experiences, they may have overcome those circumstances in different ways. It is becoming increasingly apparent to understand the cultural beliefs and values of the largest minority group in the U.S. because they can inform clinical decision-making and policy development. In a meta-analysis examining the effectiveness of evidence-based treatments that compared real-world practice criteria, it was found that parent management training appeared generalizable. This at first seems beneficial to research contributions, but for our purposes, its applicability does not translate for our target audience, the Latino population. Lastly, other problems that continue to be evident in evaluation studies include small and highly specific or unrepresentative samples, lack of long-term follow-up, and exclusive reliance on self-reports from parents and group leaders, with an additional lack of sound empirical or theoretical base. Furthermore, it is argued that lack of financial resources and skills and evaluation techniques hinder the development of implementation for adopting parenting programs. Prompting your attention to the two clarifications asked earlier, we first need to understand how do we develop our perceptions, and that is from our social cognitive influences. Bender's social cognitive theory describes that interpersonal factors, the perceptions of self, the agent's behaviors, which are the practices, and the changing demands of environment can influence children's adjustment, the outcomes. Outcome expectations or beliefs that particular behaviors will result in a specified outcome are differentiated from self-efficacy expectations or self-perceptions of one's ability to execute specific actions in certain situations. Self-efficacy expectations are linked to self-perceived skills, while outcome expectations incorporate knowledge of appropriate behaviors and environmental conditions of social support. Like Kendall and Bloomfield and Dumka, I support the use of using self-efficacy as a theoretical framework to evaluate parenting practices. In the Latino population, it was found that parent self-efficacy is related to acceptance, which is negatively associated with confidence and inconsistent discipline. Substantial evidence supports links between various parenting practices and adolescence adjustment. There has been an accumulation of research that links parenting self-efficacy and parenting behavior. The purpose of this research is to provide Mexican-American qualitative samples as parent self-efficacy and children's adjustment to inform research and practice. The significance of the study is to aid in the effective planning of parent programs and address the concerns of low uptake and dropout. Our methodology of this study will use the case study approach and collect data from 22 scales from multiple reporters that measure different constructions. Evaluation scales used were adopted from Hoover, Dempsey, and Sandler 2005 and from Hoover, Dempsey, Bassler, and Britsi in 1992. Mothers will report their parenting self-efficacy, and students will report their student conduct and behavior. Teachers and parents will report on the adolescent conduct as well. Our data sources include descriptive notes, and we will be using those in a thick description for the narrative. In addition, we'll get additional data, and we will be putting that into Atlas T after codes are evaluated. Our last data source is from an external auditor. We will use that person to confirm field notes. A results section. Wrapping it up. Common practices for validity were used and helped confirm the findings as valid. Procedures included were peer debriefing, member checks, established structural cooperation and coherence, and the use of an external auditor. Data will be conveyed through charts and will be accompanied by a thick description. Field notes will also help describe the essence of the research setting. In conclusion of the research study, I added the views of self section, a discussion section, and the conclusion remarks. Thank you, and that completes my study.